monitoring and control of infectious diseases, including the various variants of COVID-19, is essentially in the community and in health facilities. We have surveillance systems within the Ministry of Health and Medical Services where we look at the trends of infectious diseases generally and specifically looking at respiratory infections. So we're able to tell if we have a high level of respiratory infections or low level. And it can also be seasonal because we have influenza, of course, and that can be seasonal, but that's what we monitor. So now and again you do hear the Ministry of Health coming out with increased messaging about preventing infectious diseases, including respiratory infections, and that tends to be during our season period. And so that's also for other diseases like leptospirosis or typhoid and dengue fever. We're coming into our rainy season now, and we know that during the rainy season, that is when we tend to have an increased risk of those three diseases. So you'll see a lot more messaging coming out from the Ministry of Health about how to prevent leptospirosis, typhoid and dengue fever during the wet season. The Ministry of Health is watching what's happening with mpox, particularly the new clade that is in some countries in Africa. We have a communicable disease committee in the Ministry of Health, which is managed by the Fiji Center for Disease Control, but includes all of the heads of the Ministry of Health, the divisional heads, the hospital leads, our clinicians in the hospitals, where we actually plan for early detection and management if we were to get a case of mpox. But we are monitoring what is happening. Fortunately, we are able to test for mpox in PG at PG CDC. So if we were to have a suspected case, we would be able to test in country.